All right. Good afternoon, Kentucky. It is 5 p.m., the time we all come together and we say it together that we will get through this. We will get through this together. Say it with me. We will get through this. We will get through this together. And one last time, because we know it and we believe it and we have faith that we will get through this. We will get through this together. So we've got a lot of information that we're going to try to provide today. We're going to move as fast as we can, but we always got to start about talking why we're going to get through this. We're going to get through this by following the 10 steps that we take to defeat this coronavirus. The number one step, by far the most important, though they're all important, is stay at home. The number one thing you can do to honor our heroes, our frontline healthcare workers, and our first responders is stay at home. It's better than any meal you can make. It is better than any other thing that we can do, and I know they're all appreciated. But if you don't stay at home, you put those folks at more risk. So, if you're not going to work or you're not out exercising again on your own or with your family, if you're not getting supplies, you need to be at home. We'll talk in a little bit about how it's crunch time. It's never been more important than it is right now. You've done good work to date. We need you to do better work. So make sure you are staying at home. Avoid crowds and gatherings. No matter what, no excuses. Doesn't matter what other states are doing. What we are doing is flattening the curve. What we are doing is working. We are responsible for ourselves, our lives, and the lives of people around us. So, you drive up to a grocery store and it's too packed, or a hardware store and it's too packed, go home. And I know there'll be questions. This is a very important week for most of our faiths here in Kentucky. We simply cannot have a gathering where we are all together in one building, and as tough as it's going to be, we also can't get together with extended family. Practice social distancing. That's the 6 feet away. Remember, this is just like the mask is not an excuse not to stand 6 feet away from people. Standing 6 feet away is not an excuse for not being at home, right? And so these are all steps that work together. So make sure that you are at home, but if you're out doing any of the things that you have to do, that you are 6 feet apart. But 6 feet don't let you do other things that we know we shouldn't be doing because they increase the likelihood that we're spreading the virus. Know when to seek care. You all have been really good about this. We're going to be challenged. When our cases escalate or continue to escalate, we are going to be challenged. Those of us that have something other than the coronavirus that can get the services we need via telehealth without going into a facility are going to be one of the major reasons that we are not going to overwhelm our healthcare capacity. Remember that it is our duty that if we are strong enough with the aid of a doctor to ride the coronavirus out at home, that means that there is another bed that is available for someone who can't. This is our test of humanity, and that's one of the ways that we pass it. kycovid19.ky.gov. I was doing that right. Is the number one source. Go to it. I hear lots of rumors every day. There's a reason they call it a rumor. It's because it's not true. Make sure you go to kycovid19.ky.gov. I have a question later, but we can say it right here. There's a question about food service and recommendations. We have the CDC guidelines for food service that is on kycovid19.ky.gov, and that needs to be followed. Wash your hands, 20 seconds every time. Don't cheat. Wash your kids. Watch your kids wash their hands. Make sure they're developing that really good habit because that can be helpful not just as we're battling this foe, but reducing the amount of flu that you and or your kids get into the future. And make sure you are disinfecting your surfaces, the 1-100 bleach or disinfectant that you can get. Apply for benefits. In a minute, we're going to have Josh Benton come up and explain all the steps that we're taking. I know people are frustrated on the unemployment. We are actually processing more claims than we ever have in our history. Just give us time to get to a yes. We want to make sure that you are taken care of. Make sure you're also signing up for Medicaid. We want to make sure that you have the dollars and the health care coverage to get through this, and you being signed up for some form of health care coverage, including Medicaid, will help all those frontline workers, all of them. It puts dollars in the system. It helps those hospital systems. It provides more dollars for them to go after PPE and other needs that they have. Prioritize your mental health. We not only want to get through this, we want to come out strong and ready to rebuild. So rebuilding's not going to be easy. It's not going to be easy on anybody. So let's make sure we come out of this in a place where we are ready to go. We are mentally tough. We are in a good place emotionally, or we are in the best place that we can be emotionally. Do not travel anywhere. We talk about other states. Certainly don't do that. But don't travel anywhere. Don't travel to another county. Just go out for the things that you absolutely need, and then reporting noncompliance. So we always talk about the 10 steps plus one. I know all of you haven't filled out your census. This is also your patriotic duty. Please fill out your census. I'll stop asking when everybody has filled out their census. Social media. We have asked because we put out a lot of rules and restrictions. You all have sacrificed so much. We've never seen anything like this in our lifetime, but so many Kentuckians have risen to the challenge. And for those that aren't, some of the positivity that we can put out, that doing your duty isn't just what we have to do. It should be what we want to do. We should all want to defeat this coronavirus. We should all want to pass that test of humanity. We should all want to protect our fellow human being. And using these hashtags, you have the opportunity to model that behavior for those around you. So let's look at some of what we have today. And I'm going to tell you, we do a lot of important things in these. I believe this is some of the most important because the way that we are flattening this curve, been based on me. My orders wouldn't be effective unless you were willing to do what it took, and these are just some examples of that. All right, this is 23,000 pairs of gloves, sanitizing spray, and medical gowns. We talk about PPE every week. We'll put up the number here in a little bit. These are donations that are coming in based on the call. This keeps our frontline healthcare workers safe. Thank you to CSL Plasma and everybody else. We can't show all of them that are coming in, but it is all appreciated. And here is just some of those efforts. This one by Brown-Forman to do everything we can to make sure that our people are all right, that nobody goes hungry. Before this, we always thought about how people could go hungry in a state where we grow and we produce so much. And we were committed to fighting hunger before. But I hope going through this experience, if there's a positive that can come out of it, that we are more fully committed, that especially no child in Kentucky should ever go hungry. If we can do what it takes to feed every child in Kentucky at a time of a pandemic where we're all worried about getting it, certainly we can make sure every child is fed after we come out of it. This is the Warren County Justice Center in Bowling Green, Kentucky. Chief Justice Minton also sent me a picture of this, lighting up green, showing compassion to those that we have lost, and making sure that those families know that just because we can't be at that funeral or that visitation, that we are thinking about them and we care about them. All right, this is another example of our schools. These are Lincoln County schools showing that they know they are a part of Team Kentucky. And listen, our kids are sacrificing. We talk a lot about our seniors. We talk a lot about those that aren't going to work right now or the small businesses. This is taking a toll on our kids. It is. But look at the positivity that they can display. It's special. All right, these are Bellarmine Universities donating 13 cases of nitrile gloves. We need those gloves. This is one of those areas that I know that there are a bunch millions of pairs of nitrile gloves out there, and it's one of the areas right now that is the hardest to buy. This is one area where we can, and we should, based on the supply that's already out there that we can donate, better protect our workers. So thank you to Bellarmine. Yeah, special moments between our families when we are going through something that creates the nervousness, the anxiety, the fear, even the anger, right? Because it's natural to get a little angry during this. Make sure you have those moments where you realize that if you're lucky enough to be in a stable family, you're getting more moments together than we ever would have thought in our regular society that we would have. And do your best to try to treasure those. All right, and this is again Montgomery County Schools. Look at all those meals they're preparing, and this one caught my eye for one reason. We want everybody out there doing what it takes to feed and protect people, but sometimes people send the pictures in and they're hugging on each other, or they're really close. We can't be doing that. If you are even doing something like this, make sure you're 6 feet apart. Look at your operation and how to do it, and they've done it. I mean, right here, and I know we can't click on it. If you do, you see all these workers that are spread out. So this is not only Montgomery County feeding their kids, they are practicing the social distancing that reduces the spread of the virus while doing it. So next we've got a video. You know, we've done videos of coaches and some of our pastors. What we haven't highlighted are a couple of our local leaders. So this is Mason Barnes, who's the county judge executive in Simpson County, and he's just going to talk about a lot of the same things that we are, but why they are so important in his county.
I'm Mason Barnes, Simpson County Judge Executive. I first want to say that Governor Beshear is doing an outstanding job with his directives to help keep Kentuckians safe at home. Being the Judge Executive of a county that borders Tennessee, I can tell you that the travel directives from the Governor are spot on. During this time, we should all limit our travel to that of necessities only. Work back home, store back home. Kentuckians by nature are very friendly folks, and handshakes and hugs are important to us. Therefore, I know the concept of social distancing is unusual to us, but social distancing and limiting our social interaction is the greatest tool we have to combat this COVID-19 coronavirus. I'm ready for my community to get back to normal, as well as our state and our country, so we have to take these directives seriously. Let's all pitch in and do our part. We can do this, Kentucky. We will get through this. Thank you, Governor, and God bless Kentucky.
Well, thank you to County Judge Executive Barnes, and he is representative of judges all across Kentucky in taking steps that I never conceived or thought that I would have to take as governor. I will tell you, in every single area, not only have our local leaders been supportive, but they've been willing to go out and do the hard work and the difficult work and the unpopular work to make sure that our people are protected. All right, we're going to have 2 updates. First, I'm going to ask Dr. Stephen Stack to come up and do an update on testing. And then right after that, when he's done, I'm going to have Josh Benton come up and give an update on unemployment. Dr. Stack.
Thank you, Governor Beshear. So the update I want to give is related to the testing we're trying to fan out across the state. So as I start, I would like to first thank Gravity Diagnostics in Northern Kentucky. You've been a fantastic partner in this, and I hope we can celebrate more later in the week and bring you here to express our gratitude. Thank you also to UPS. UPS has provided our shipping logistics, and our team worked with them throughout the weekend. They did a fantastic job. So on very short notice, and obviously with not much lead time, they were able to get materials shipped out over the weekend so that they arrived yesterday. We have, at my last count, 32 partner hospitals. These are not in the Golden Triangle. By agreement with hospitals in the Golden Triangle, so Louisville, Lexington, Northern Kentucky markets, the hospitals are the anchor facilities for those communities. So we're using other hospitals across the state to try to get much needed testing capacity in a reasonable turnaround time out to the rest of the state of Kentucky. So thank you to the 32 hospitals that partnered. Again, on very short notice, in a matter of days, 26 were signed up and ready to go as of today. As of yesterday, rather. The materials had just been received yesterday afternoon, and the first 12 specimens arrived before 6:30 a.m. this morning. I consider that a great success to pull that around that fast. We are going to ramp up to a maximum capacity of 2,000 tests a day distributed regionally across the state, partnering with those 32 hospitals. It's subject to the availability of swabs and testing materials, which continues to be a roadblock. But we have the systems in place. Testing has started, and we have enough supplies on hand to begin to gradually ramp up over the first 2 weeks. So in a time of many difficulties, I'd like to really thank all the partners I mentioned and also the Kentucky Department of Public Health, my colleagues and the people that I have the privilege to work with who did really fantastic work under a lot of pressure to deliver this. Can you please put up, James, I do want to talk about testing just very specifically, though. These tests are not for everybody. So again, remember, we want to make testing available for everybody who needs it, and we don't have enough testing available for everybody who needs it. So in a world where resources are limited, we have to deploy a scarce resource to the greatest good. So the folks that we are going to use this resource on are these individuals. You have to have symptoms. So you have to have fever plus shortness of air or cough or diarrhea, because some people get a gastrointestinal syndrome with this. So those are the symptoms. And then in addition, you have to have these other criteria. So the first tier is healthcare workers and first responders, or people who are over 60 who have high risk because of their age, or people who live in what we call a congregate setting, so nursing homes, prisons, settings like that, where we really have to work as hard as we can to keep the disease from getting in there and spreading. And then if there's excess capacity beyond those communities, we'll go to Tier 2. Tier 2 involves people with chronic medical problems. And I just had a few of them I listed up here, but there are a number of other chronic medical problems that we would use. Again, the goal would be to get to the day when we have all the testing resources we need to test everybody who needs testing and to be able to do it more liberally. Right now, we're not there, and so we have to deploy it to the greatest good. I want to give two last messages on this point. One, if you go out to a hospital and you ask for testing and they tell you you don't qualify, I want to tell you I support the hospitals in their decision making. I'm working with many of these hospitals. I talk with CEOs and chief medical officers from those hospitals. We message regularly through many channels. They want to be able to provide you the most robust service they can, but they are working in partnership with me and with the state of Kentucky to try to use these resources to the greatest good for the most people. The other thing, just a word for those of you who seek testing on your own, there are many different tests out there. Some of them test for the virus itself, the polymerase chain reaction test where we swab your nose or deeply in the back or up front. Those are the tests that say, do you currently have active virus? There are other tests that test for immunologic things such as IgM, IgG. There's a lot of complexity that goes with this. I'm just going to caution you have to be very careful. It would be alarmingly easy for you to hand over your scarce and precious financial resources and get a test that doesn't help you one bit and only empties your wallet. I would urge you to not do those things unless you are partnering with a properly qualified healthcare professional who understands what those tests are or are not useful for. Please don't waste your hard-earned and scarce cash in a time like now when we need to conserve those things. To get through this, rely on qualified healthcare professionals to give you good advice about when they're useful. I'm thankful to the governor. We are going to get through this, and together, I'm very grateful for the efforts you've done. I think that we've shown success as a state, and it's a time to really celebrate Team Kentucky. I do have to say, though, there's a lot of hard work ahead. We are not out of the woods, and all of these efforts are so essential because all of the good work can very quickly be undone if we don't stick with it. So thank you very much for all you're doing. We appreciate it. And now Josh is up.
Thank you, Dr. Stack. Thank you, Governor Beshear. Just a couple of updates on unemployment insurance, specifically on a point that is, I know, frustrating many throughout the state, frustrating us as well, and that is the backlog on the phones. We know people are trying to call in, specifically those that need to call in order to maybe reset a PIN number or just general help with their application. Just to let you know the steps that we're taking, we have been actively training and adding staff daily. Our goal by the end of this week is to be around 1,000 to 1,200 people on the call center line. That is up from 12 3 weeks ago. On a normal average period of time, we have 12 people on the call center line. So we're ramping up to 1,000 to 1,200. If we need more, we'll add more. That is our priority, is to fix this. We know it's the thing that is taking the longest, and we wish it wasn't. But we're doing everything we can to add capacity. A couple of tips for folks. We know that several of those individuals that did not typically qualify may have received a denial letter last week or the first part of this week. We stopped as many of those that we could before they went out, but some still got out. If you receive that, it can be disregarded. It's something that is automatically generated, and you may actually receive your first payment before you receive your approval letter. But we went ahead and processed payments for those that qualified, but we know that caused some confusion. We apologize for that, and no one should be getting those denial letters. A couple of other things that, just a reminder to folks, for your first payment, it's going to be automatic. You don't have to request payment. Going forward, the second payment after that you can request, but for the first one it's automatic, except for those folks whose companies were e-claims. Follow the instructions that your company provided you, and they will tell you how to claim your payment. Last couple of things is some good news. We have been able to move back the date that individuals can get that 13-week extension. So for individuals who UI might have expired after July 1st, 2019, you are going to be notified within the week about how to reopen your claim for an additional 13 weeks. That's really good news, especially for several of our communities in eastern Kentucky where the miners had lost their job and exhausted their benefits. So that notification will be coming within the week. And finally, everybody is waiting on the $600 that will be added to the weekly benefit. So are we. We're waiting on that funding stream from the federal government. We're hopeful it'll be this week. As soon as we get it, we will start those payments. Thank you, Governor.
Thank you. So let me just add on to what Josh is saying. I know it's taken too long. We are doing everything we can, going from 12 to up to 1,000 people. I hope folks out there see the steps that we are trying to take. But that is not to say that your frustration or your anxiety is wrong. It's right. It's right. You're worried about yourself and you're worried about your family. And we're going to do everything we can to get your approval and to get your payments going as fast as we can. Keep letting us know when there are issues. It's our job to fix them. The buck stops at me, and I don't believe in excuses, even in a worldwide pandemic that we've never seen before. Our job, my job, is to provide for my people, for everybody out there that needs it, and we will continue to work until we get that done. All right, we've talked every day about how this is a critical time. It is an absolutely critical time. What we are doing right now will determine where this virus is 2 weeks from now. As we know that we are escalating, how much we flatten that curve depends on our commitment day in and day out. If you did really well yesterday, thank you. I need you to do just as well today, and I need you to do just as well tomorrow. I want to show the COVID Act Now slide, which just gives us that idea every single day on what the difference between all of us doing our duty and having strict compliance versus poor compliance could mean. Now, I will tell you there are a lot of models out there. One just updated and had an even more optimistic scenario. I hope they're right. I hope they're right. But our job is to not take anything for granted and to know that there are many more pessimistic models out there that are worse, significantly worse than what we're showing here. We think this one is kind of in the middle, and it just gives us that concept that how well we do could mean 11,000 lives or more. And so let's make sure that we stay committed now, like we have always been, to getting this done. But let me again say thank you and to try to keep motivating you. If we look at how we do versus other states, and I make at least one mistake every day when I'm up here. I said that one of these two models was normalized for population. Dr. Stack told me afterwards they are both normalized for population. They just show it in a different way of how Kentucky is doing. And if you'll show the next one, James. And that's that, regardless of how you splice the data, what you're doing is helping. So keep it up. If we just continue where we are right now, we're still going to lose more people. Let's do better than that. We all like sports. In Kentucky, most of us are basketball people, right? Do you sit on a lead? Not that we have a lead, but do you? Or do you make sure you do what it takes? And here, we're not talking about a win or a loss. We're talking about the lives of people. So let's commit ourselves to doing everything we can to do even better. On here, we might be, number 6, but we've never been okay being number 6. Let's be first. Let's be first in the country on this. Remember, social distancing of those 3 ways we fight the coronavirus is entirely in our control. How much we can blunt this curve is up to us. And I want to show the influenza, which I didn't tell James that I was going to do before this. And by the way, Kenneth helps run all of this now off of his phone, social distancing and being healthy at home. But I want to show, hopefully next time, how this compares to last year. But this is showing how social distancing is absolutely reducing the spread of viruses. What you're doing makes an impact. And if you feel like you don't have control during this time, I get it. I get it. But you do. You probably have more control just based on your everyday actions in addressing this crisis than any other crisis we have or we ever will face. So keep it up. You are a part of Team Kentucky, and your actions save lives. So we're excited about this. What we're concerned about is where we are seeing some of our cases. And I'm going to go through kind of 3 areas today where we are. The first is nursing homes. So to give you a concept of how concerning that this can be, Indiana had 11 deaths in 1 nursing home. Alabama currently has positive tests in 31 of them. So this is where we are on long-term care facilities, and these numbers have increased significantly even from yesterday, and we have gone to every one of our local health departments and tried to work with them to make this as accurate as possible. We have 55 residents in 21 healthcare facilities that have already tested positive for the coronavirus. We got to do everything we can to make sure the coronavirus doesn't get into these facilities, and we take significant action when it does. We have 22 staff right now that have tested positive, and we've lost 11 Kentuckians that were in some form of long-term care facilities. Those were all residents. None of those are staff. We have 55 resident tests pending that are outside of this. They could come back positive, they could come back negative, but they are pending, and 41 staff tests are pending. So some of our steps are down here that we are taking. It's everything from trying to provide and encourage the use of masks, eliminating the communal elements in these facilities. We have not only restricted, we've basically banned visitors except for in end-of-life situations. We're working with personnel. And let me say, we got some heroic staff that are working in these facilities that self-quarantine. We've got staff that are actively taking care of people that they know who have tested positive, who are self-quarantining themselves, so that they can try to help that individual get through. We're working directly with a number of the hardest hit facilities. I know Dr. Stack was personally on the phone with one county and their facility today. This is a concern, and we've got to make sure that we prevent the coronavirus from getting in as many of these facilities as possible, and then we need to react quickly and swiftly when it does happen. Next place is one of our prisons, is the Green River Correctional Complex. As of today, and one of these just came in about 20 minutes before we came up, we have 14 total cases, 9 inmates, and 5 staff from the same facility. And just like our nursing home facilities, where just about everybody is vulnerable, the way that our prison facilities are set up makes us want to prevent the coronavirus from getting into any of them. And right now, this is the only facility where we have had any inmate test positive. We are taking significant steps within those facilities to do everything that we can to protect those that are in there. Tomorrow, and I don't have it today, I want to show you a version of the masks that some of our inmates are actually making. It's not only something that helps because they're going to be provided to all the other prisons, but it gives a little bit of control, again, in a situation where you would feel like you don't have it to those that are facing this. Again, we are doing everything we can to quarantine and move those that have tested positive and or been in close contact with those that have tested positive to other areas. All right, third area of concern, Western State Hospital. Here we have 13 total cases, 9 patients, 4 staff. Here are some of the steps that we are taking. We talked about them yesterday, and to give you just an update, if I went back to, I believe it's Green River, we had 6 new positive tests after yesterday's press conference, and additional ones that have come in since. So how quickly this can spread inside certain facilities. We've got our Office of Inspector General, and we have the Secretary of CHFS working directly with Western State Hospital to make sure that we are doing everything not just to protect the patients, but to protect the staff. And I know the staff in all of these facilities are scared. I know they are. And we're going to do everything we can to work with them and to protect them. But I want them to know how appreciative that we are, that they are willing to help those that truly need the help, knowing what we are facing. And on that note, just want to take 1 second in talking about how important our frontline healthcare workers are and our first responders are, to point out that we have advertisements out there from other states or hard-hit regions willing to pay big dollars, and it's causing some issues in some of our healthcare facilities. Folks, we need you to be a part of Team Kentucky. We know that there might be other opportunity out there, but if you go to another state and come back, you're going to have to self-quarantine for 14 days. And going to a hot spot, though they need help, and then coming back, we're going to have to be really strict about that if you do it, because your potential for exposure is so much greater. But let me say right now, we need you. We don't have excess. We want to help all of those around us. But if it's appreciation, let me tell you, you got it. Not just from me. It's from everybody all over this Commonwealth. So we need you. We hope that you stick with us, and your efforts are going to be incredibly important in helping us get through this. Before I provide the update, let me also briefly talk about how I know this week is really important to multiple faiths, including mine. It is Passover. It is Holy Week. It is a time where we get together not just once a week or twice a week, which is what my family does with our church, but multiple times during the week. We can't do that this year. I know it's hard. It's hard on us. My son was supposed to be baptized on Sunday. That's not going to happen. But We know, we have evidence, we have multiple areas where this is spread in a house of worship, and at least in one of the areas where people have died as a result. I'd like to think that the lessons that we can learn from our faiths tell us that we ought to be committed to protecting one another, to loving our neighbor as ourself, and to not want to put any of our neighbors anywhere in this state in harm's way. And where folks are intentionally putting people in harm's way, we're going to start taking action. I got over any ramifications of doing what it takes to protect lives a long time ago in this, and we're going to make sure that we don't have 200 people coming to one place inside of one building where we know people are going to die as a result. And you know what? My faith is one of the things that compels me to do that. My faith teaches me that we protect one another, and when others aren't willing to do the right thing, we step in to protect those that might otherwise be vulnerable. 99.99% of all of our faith leaders out there, thank you. Thank you for what you're doing. I know it's a hardship on your house of worship financially. I know it's a hardship on what you view as your pastoral duties. I know that this has turned our entire world, in every way you probably see your service to your congregation in the world, upside down. But I promise you, you are doing the right thing, that you are making sure that at the next major celebration or the next Sunday that we're able to be together, that you have your entire congregation there. So thank you to all of those faith leaders out there, and please spread the encouragement. Please give voice to it. Please give voice to your and your congregation's sacrifice, because that positive peer pressure, and it is, will hopefully prevent others from doing something this week that we know will set us back, will spike the curve, and will cause harm to people that are out there. All right, today's results are higher than the last couple days. But remember, the last couple days we were talking about the fact that we thought that they were artificially low, and that it was in part due to some labs not reporting over the weekend. So our total number of new cases today is 147, and that brings our total cases to 1,149. Now, 147 is the largest number we've reported in a day. But as we look back at the 2 days before it, where we thought those numbers were low, and we think that some of those reports have come in today because of it, our average during those 3 days is about 80. And 80 was lower than the 3-day average for the 3 days before it. So while this is a large number, and it is, we still don't see the numbers going the same way in Kentucky as in so many other places. So what we will say today is the largest number of cases that we have reported, but our 3-day trend is actually lower than our last 3-day trend, and I'm not sure many places in America can say that right now. We also are sad to announce 7 new deaths that we had. Let's make sure that we honor those families by lighting up our houses and our places of business and our institutions green tonight. It's a color of compassion, and it lets them know that they are not alone, and the loss of these 7 Kentuckians is a loss to all of us across Kentucky. It ought to make us recommit to doing the things that it takes to lose fewer and fewer Kentuckians every chance that we can. To those 7 families, we are so sorry for your loss. It brings our total number of deaths to 65. One Jefferson County death reported yesterday was an Indiana resident, and so our total loss is 65 amazing Kentuckians who we know will be missed. So our new cases by county are 51 in Jefferson, 6 in Fayette and Muhlenberg. Many of the Muhlenberg are the Green River. 3 in Callaway, Davis, Hopkins, 2 in Boyd, Boyle, Bullitt, Campbell, Lyon, Monroe, and 1 in Adair, Allen, Breckenridge, Caldwell, Christian, Franklin, Graves, Greene, Harrison, Kenton, Laurel, Letcher, Marshall, McCreary, Montgomery, Nelson, Ohio, Pulaski, Russell, Shelby, Simpson, Spencer, and Warren, and we are still confirming 40 of those cases and where they are. Remember, different reporting periods for local health departments and ours. We have different cutoff dates. But as you listen to that list, it's everywhere. It's everywhere. No false security about no reported cases in our county. It's everywhere. Thankfully, our local leaders have been acting like that, and thankfully our people know that. So remember, the coronavirus is out there everywhere we're at. It's why we are healthy at home. It's why we're not doing house parties. It's why we're making a major sacrifice in a very special week for most of us. This is what it takes to defeat the coronavirus. Our new deaths today include a 60-year-old male from Jefferson, a 94-year-old female from Lyon, an 85-year-old male from Jefferson, a 70-year-old male from Jefferson, a 42-year-old male from Jefferson, a 72-year-old female from Lyon, and an 83-year-old female from Adair County. Again, let's make sure we light our homes and our places of business and our institutions up green tonight. And let's make sure more than ever that we ring those bells tomorrow at 10 a.m. and every day. It's just another show of unity, both for how we are going to defeat this coronavirus, but also unity. And it shows that we are behind and we are with those families that are currently grieving. We were asked for a breakdown on race of our positive tests. Right now, we can account for about 68% of the positive tests, and we're working on getting that data for the rest. It's supposed to come in, but it's not always filled out on the sheet, but we're going back. Of the universe that we know, it is 79.25% Caucasian. It is about 12% African American, 2.6% Asian, 2% multiracial, and it breaks down about like that. I know that we've seen a lot of national stories right now on the breakdown, and it's important to know it. We're going to make sure that we get it accurately across all the tests, but that is about 68% of the numbers that are in. And I'm watching those debates and stories as they're coming out nationally, and I will say that they are concerning, but they do make me proud that we expanded Medicaid, and that is for all of our people when we did. I think that it's given us years to try to all of us across Kentucky, get healthy, get regimented, get the medications that we need as we move through our lives. Just want to put in context today our 7 deaths, or even yesterday when we had 14. New York today had 731 people that they reported passed away. New Jersey had 232, Pennsylvania 78, Indiana 34. Those are all Americans, and we will miss all of them. And I hope that gives people out there kind of a scope of why we fight as hard as we do, why we make the sacrifices that we do, why we acted so early and so aggressively. And for everybody out there that has sacrificed, it is paying off. Now, we got to stay diligent because we have, like we mentioned, we have the coronavirus in some places that we do not want it, where people are the most vulnerable. So let's make sure that we don't spread it any further in those facilities. All right, we'll turn to questions. I think we have Joe Sanka, Phil Pendleton, Joe Ragusa. Close enough? Yeah. All right, sorry about that. And we have Jordan Hensley here today. We'll go back and forth with questions. And the first question, let me start here, is different outlets asking for more details about how we're procuring PPE. We are trying everything. We are working with companies that normally procure it. We're talking to healthcare providers that do it. And about every day we get about 80 texts or emails or calls saying somebody knows somebody that has a big shipment coming in, and we run down all of them. With that said, buying PPE right now, virtually nobody has orders that are actually coming in, and it's concerning. We did have some luck today on a small scale with, I think, about 15,000 N95 masks, and we'll continue to work every single day, whether it is in-state or out-of-state. We chase down the ones that you think can't be true because of the numbers, because if there is just one small opportunity, we want to make sure that we have what we need for our people. But when it comes to PPE, and it's the Wild West right now. I mean, it's everybody out there trying to find what they can, and then you'll get a story that seems reputable, and then they'll say, yeah, but they want $10 million before you ever see the merchandise. And obviously that's one where it's not coming in. Other times you have folks that in the past, outside of pandemic, have been able to get different supplies, and they think they can get them, but then the shipment doesn't come in, either because they weren't able to get it like they thought they would through their supply chain, or it's diverted to different areas. And one of the reasons that more is not coming to Kentucky is honestly we are doing a better job of flattening our curve. A whole lot of it's being sent to the hot spots around the country, and you could understand that decision. But my job is to fight for as much of it as we can get here. And I know that whether it's our media or other folks are used to answers that are really structured about we do A and we do B and we do C, but that's not how this process is going. Every day is a different day, and many days I feel like Charlie Brown trying to kick the football. But that doesn't mean that there isn't that day where we kick that football and we get the amount of PPE in that we so desperately need for our frontline workers. I want to thank our members at the EOC, in our Department of Public Health, in the governor's office that are working every day chasing down these leads that are as frustrated as they can be. But if there's that possibility, we've got to do what it takes to get there. So we'll go in reverse order this time. We'll go Joe from Spectrum, if you want to start us off.
My main questions were about the unemployment line. It seems like the state's been doing a decent amount to kind of address some of the concerns, but how much have we heard from people who have had kind of complaints about the system that is currently set up, and what more do you think that might need to be done in the weeks and months ahead?
The question is on unemployment and complaints that I've heard and what more we need to do. I understand every single complaint. These are people trying to provide for themselves and for their families that shouldn't have to wait, but we're working on an antiquated system where the answer used to be no and now it has to be yes. Huge numbers of people that now qualify that the system is designed to say no to automatically. I mean, the build up from 12 to 1,000 people on the phones, and then we need better infrastructure too, IT infrastructure. That's really hard to do in the middle of a pandemic, and I worry every time you do that, what happens is the whole thing fails. So we're working on every day on making it happen. I think the group will be 10 to 20 times larger than it has ever been, but we won't stop at the steps that we've taken. So it's hard to ask people to be patient, and they've been more than patient already. But what I'd say is stick with us. We want to make it happen. Just because you've gotten a letter that says no doesn't mean that the answer isn't yes, and we'll try to do better each day. This next question from WLEX is on that. For folks that say they've been approved but have not received their checks, they don't need to do anything. Their first payment is automatically. And I know they're trying to call in. We'd ask, given the call volume, that if their deadline for that check hasn't come in yet, that they preserve that call capacity for other people. They can also visit kcc.ky.gov, where most questions can be answered there. Another question. We hear the governor's office and state homeland security have sent staff into emergency management to oversee operations there. We're all working together on this. We've never faced anything like this before, and it is all hands on deck. Homeland has helped us track down additional respirators. They're helping us to set up the field hospital. There are a lot of additional state workers that are helping out. And I, as the governor, am being asked to expend amounts of dollars that we've never really seen before. And yes, we're going to do it, but I am intimately involved, directly involved in everything that we're doing, and we've got people fanned out everywhere. But no, this is a big team effort, and we appreciate what everybody is providing. Phil.
Some people are being called back to work, and they've been, laid off, and they call back to work, but they don't feel safe going back to work. Can they still get their unemployment?
Well, if folks have been fully laid off as opposed to furloughed, I believe that they can. But let's ask Josh to give you the right answer on that.
So there's just that question on if an employer calls their employee back to work, do they have to report back to work? That's very situational. A lot of the large employers have done temporary layoffs with the expectation that someone is going to be called back. We have made provisions for good cause for someone to leave their job for a period of time. That has to be, if there's risk of exposure, and so that employer, if they can make accommodations to make sure that's a safe work environment, then that individual's going to have to go back unless they can show that there's a risk there if they go back. And we think employers are doing a pretty good job overall of keeping people away if it's not safe, but it's situational.
All right. Many UPS workers are saying the company isn't doing enough to protect them. They say they're not providing them protective gear or enforcing social distancing. What's your response? This is the first question I've gotten on UPS and that issue. I want to be able to talk both to the workers, and some of them had sent me a letter that honestly I just saw for the first time today, as well as management. GE, I believe, just announced today at Appliance Park that they had come to an agreement with their union and workers. That's the next question here. So the next one is, does the governor think that mail-in voting should be expanded for the June 23rd primary? Does the language in the budget bill allow him to do that? I believe that if recommended by the Secretary of State, that if he recommends that mail-in voting be the way that we do it this year based on the coronavirus, then yes, I believe there is the legal authority to do it. We're right now just in April. I think we want to see where things go, but I would absolutely be in favor of mail-in voting if the coronavirus is still posing the threat that it does today, given our workers, our poll workers, are by and large in the most at-risk group. Jordan.
Yes, I drove by Lakeview Park here in Frankfort today, where the pilot testing site is.
Right.
And it looked pretty empty.
Yeah.
I'm just kind of wondering what the status of that is.
Question is for an update on the drive-through testing where we had done the pilot here in Frankfort. It's on pause. We were excited about the announcement with Gravity Diagnostics, and UPS is helping us to ship that all over the state, and thus far that's going well. That's going to depend on our number of swabs. On the drive-through testing, we've run into the same problems that everyone else has, and that's the amount of PPE and the amount of swabs. And we're hoping that our partners will be able to secure those in a level for us to get it done. So we are still hopeful there, but we want to make sure before we launch it that it is sustainable. They're good partners. They're doing their best, but like everybody else, they were assured, just like we're assured all the time, that the different PPE and requirements would come in. Will and has the state released any juvenile inmates? I believe the answer to that is yes. What I've got from Justice doesn't give a number here, but Juvenile Justice has reviewed all cases for youth residing in the youth development centers and group homes to determine appropriate candidates for early return to the community. Youth designated for early return within 30 days of their originally scheduled release date were being held for nonviolent and non-sexual offenders were designated for release. As of today, all but 2 identified youth designated for early release have been released. But what I don't have on here is a number. We will get that for you, whether it's larger or smaller. That's the type of number that the public deserves. Joe.
The president has promoted using a combination of hydroxychloroquine and azithromycin to treat COVID patients. Are you aware of any hospital in Kentucky that is using that to treat patients? And also, what does Dr. Stack?
I'm just going to ask him to answer that one. It's about whether one is a malaria drug, maybe the other is too. 2 different drugs that are out there that have been mentioned in some of the White House briefings that maybe they've promoted the use or at least mentioned it. I'd like Dr. Stack to be able to give us the real answer there.
Thank you, Governor. There's a number of treatments that are being considered: hydroxychloroquine and similar drugs, Zithromax, which is people commonly use for pneumonia and other infections, steroids, convalescent serum, where they take folks who have recovered from the infection and draw their blood and try to purify and find the antibodies there to see if we can treat. All of these things are experimental. None of them have reached the level of scientific comfort to be able to recommend that these are the proven treatments for the condition. There are institutions, I'm sure, throughout the state who are using protocols that use some or all of these. They are doing this using their best medical judgment, which the physicians certainly are asked to do. And should they become approved standard of care, then of course we'll do everything we can to try to help make it available across the state. But right now, I would encourage people to seek their medical advice from licensed medical professionals, and at present those things are not yet proven to be beneficial, and it does matter. If you make the wrong choice, harm can be caused as well. So you have to really exercise care and caution before we proceed to do these things at scale.
And we do know that there's at least one plasma trial going on right now, and I believe that is from the Baptist system. Question on Gravity Labs and the dollars not coming from the general fund. Let me get you an answer on that, but we're going to have significant funding coming from the federal government that's going to provide more than enough dollars to pay for that monthly amount. Can I comment on the budget recently passed, how I feel about the 2000 pay raise I'd hope to give teachers, and the difficulty the legislature had in crafting a budget with so much economic uncertainty? I came in as governor wanting to expand opportunity for everybody, with a strong belief that public education is the way we break cycles of poverty, and that our teachers deserve so much better than what they had seen. I wanted not only the raises, I wanted increased SEEK dollars, I wanted more money to go into building funds for our public schools, for textbooks and technology, more clean, green school buses, more dollars for early childhood learning, more social workers. We were sitting at the brink of true opportunity to move ahead, and then we have a worldwide pandemic that we were hit with. And so we don't live in the reality we want to, we live in the reality that we do. And we've had to make hard choices, at least through this year. And it is very difficult on the legislature to craft a budget in these times. My commitment is that we will come out of this. We will come out of this. We will rebuild. And all of those things that I've pushed for, I want to see happen while I am governor. And we don't know how long or what the rebuilding will look like precisely, because a lot of it's going to depend on how much the federal government helps. But I still believe that no teacher should have to drive an Uber at night just to get by. I still believe that we will only get out of being number one or number two in child abuse with more social workers and a smaller caseload. I still believe in every single one of the things that made me want to be your governor. Right now, I've got to focus every day on protecting lives and doing what it takes to get us through this. A reader reached out and sent a screenshot of a dog groomer that is still operating. A dog groomer should not be operating. At this point, we shouldn't be. Again, that's the honeybee example of how these things spread. I'll say our veterinarians, at least from one of our personal interactions, are doing a good job. We had to take our dog in for something, our remaining dog in, for something routine the other day, and they were actually meeting the dog at the car and taking them in. That same type of adjusting for almost a curbside. So, Joe.
In regards to church services, I know there was at least one in Jefferson County that still decided to try to meet on Sunday. I imagine there's a few probably across the state that are doing that. What kind of action do you envision possibly needing to happen, or do you envision actually taking any action to prohibit them from meeting in person?
The question is on any public gathering, churches was the question that still tries to continue. What action would we take? I think we're going to have some more news on that tomorrow. But I'm going to do everything reasonable that we can do to make sure that somebody doesn't hold a mass gathering that harms the people that come. Listen, I believe it's in part on that congregation not to come, but still. I mean, I don't want one decision that somebody makes because somebody tells them it's a test of their faith to ultimately put their life in danger. Every lesson I take from my faith tells me that that's not right. That is not right. We're supposed to have a duty to our fellow human being. And my faith, that when Jesus was asked about the most important commandments, it was, love your God with all your heart, and secondly, it was love your neighbor as yourself. Loving our neighbor means that we should do everything we can to prevent them from being in the type of circumstance that this would spread. We have a question here that I haven't seen before about cars being repossessed, which presents additional problems for the family. Let us get back to you on that question. That is a concern during this time. There's a question on Kroger and Kroger employees on social distancing in packed stores. I know we just saw news today of limiting the numbers of shoppers. And then there's a question of how many businesses have been able to start manufacturing PPE. We know of about 4, but we'll get you the full rundown for everybody that we have contracted with. Phil? Okay. Okay, the answer on juveniles from earlier is 11 were identified for release and 10 have been released to date.
My question is kind of a follow-up to what Joe was asking about the churches. Do you have any idea, like, on the number? Are we talking just like a small handful of churches that are still holding services, or what parts of the state, anything like that?
So from the question is how many churches, but it could be any gathering are still planning on holding services. As of yesterday, from different things we saw out there, it was maybe a couple dozen, but we already know a number of those have already gone ahead and done the right thing and said they're canceling them. What we saw after the one church, which is actually just across the line in Bullock County, well, if they're going to do it, why shouldn't we do it? That's not the right decision. The right decision is what's best for all of the individuals that are there. And I don't think I've said this for a week or two, but I serve communion at my church once a month, or every other month. We switch off in the deacons. And when I think about everybody that's coming down to receive communion, I see a whole lot of vulnerable Kentuckians there. I just don't want to expose people to the risk. Jordan.
Back to the pilot testing site, were you able to test anybody there before supplies ran out?
The question is, were we able to test anybody at the pilot site before supplies ran out? Yes. I think we did at least a couple hundred tests, and we did those couple hundred tests in large part on almost all on first responders and folks that that had symptoms or were in the most vulnerable group. Not all of those results have come back, but it was really important. It showed us some of the challenges that we'd face. I'll give you one example, and that was we had some state police go through, and one of them pointed out what happens if a car breaks down. So we didn't have any of those services either set up, admittedly, or on site, because you could see the whole thing shutting down if that would happen. So I think we've learned some lessons from it. I saw an announcement today, and we haven't talked directly with them about Walgreens, maybe starting drive-through testing in Kentucky. I hope that becomes a reality. What we see on all of these is folks that even have the contracts in place and they're ready to go. And do they have the swabs and the kits and the PPE on that day? They've got orders from them, just like we do. And so I hope anybody who thinks that they have the ability can do it, but how they do it is critical. Right now, even with that, we don't have enough testing kits for everybody. We've got to prioritize the most vulnerable. All right, Joe.
I have a testing question. Is the state going to release the number of residents per county tested, as some states have? And you've sometimes used a projection of how many have been tested based on the percentage of certain private labs. Can you say how that projection works technically?
So the question is on numbers of tests, projections on the numbers of tests, and if we can provide tests by county. On tests by county, we now have so many labs that we are asking for their overall numbers of tests, but not a report on the negatives. And then we're asking for the reports, obviously, on the positives. So I think we would have a hard time generating and a hard time with the data to be able to show total number of tests per resident per county. Now, we can confirm that there have been 21,604 tests. We know that's the case. Our projections have been based on the positive versus the overall rate, both in the state lab and in all the labs that we've reported to date, knowing that some haven't, and projecting out pretty much that same number to get to the overall number of tests that are done. One of the reasons that sometimes we don't have a positive that may be reported by a local health department is we have labs out there that we don't know about that'll be the first one or two in, and they haven't been confirmed by our state lab with the 5 positives and the 5 negatives. So we're doing our best on total number of tests. We know we're more accurate now than before. We've brought in the National Guard to help out each and every day to try to go through every lab that we know of that hasn't reported in that day. And I think we're taking a number of steps to address accuracy that every state has faced as you've gotten more cases. When you have 30 cases, it's pretty easy to track who they are and where they are. When you have 1,149, it gets a little harder. I don't have the projection based on the way we did it before, but we can get that for you. All right. As usual, we've gone a little bit long. Kentucky, we're going to get through this. We're going to get through it together. And let's make sure as we go that we keep our compassion and our kindness. Let's remember that everything that we are feeling, our anxiety, what puts us on edge, everybody else is feeling too. And let's make sure that we're not an outlet in trying to get out our frustration in a way that will put somebody else maybe over that edge that's feeling the same way. It has never been more important for us to be a good neighbor. It's never been more important for us to be kind. It's never been more important for us to sacrifice for the greater good. But you know what? We're not a state, we're a commonwealth. When we were founded, it was about coming together for the common good of all of our people. And it's hard to see in these times. This is our opportunity to be great. This is our opportunity to be able to do something that we'll be telling our kids and our kids' kids about. And maybe years from now, people will be writing about how we made the necessary sacrifices to protect one another. We'll see you at 5 tomorrow. And we have, I believe, a video to help lift your spirits with a lot of our public school kiddos out there. Thank you.
I got this feeling inside my bones. It goes electric wavy when I turn it on. Off from my city, off from my home. We're flying up, no ceiling when we in our zone. I got that sunshine in my pocket, got that good soul in my feet. I feel that hot blood in my body when it drops. Ooh, I can't take my eyes off of it, moving so phenomenally. You're more like the way we rock it, so don't stop. And under the lights when everything goes, nowhere to hide when I'm getting you close. When we move, well, you already know. So just imagine, just imagine. Nothing I can see but you when you dance, dance, dance. Feel good, good creeping up on you, so just dance, dance, dance. Come on.
For the bare necessities, the simple bare necessities. Forget about your worries and your strife. I mean the bare necessities are Mother Nature's recipes that bring the bare necessities of life.
Hakuna Matata. What a wonderful phrase. Hakuna Matata. Ain't no passing craze. It means no worries for the rest of your days. It's our problem-free philosophy. Hakuna Matata.
It might seem